Good morning, everyone. My name is Janice. And my given name is Yenna, and I'm an uninvited settler and immigrant on the lands of the Squamish, Musqueam, and Tsleil-Waututh First Nations, colonially known as Burnaby. And I'd like to present one aspect of my practicum with the Indigenous Cultural Safety Team at Fraser Health, which is my culminating project, excuse me, titled Indigenous Primary Care: A Synthesis of Cultural Safety Indicators. I'd also like to respectfully acknowledge that Fraser Health provides care on the territories of the Coast Salish and Clipperton Nations and is home to 6 Métis chartered communities. So my project came about at a time when our team was in the planning stages of an evaluation of the Indigenous Primary Care Program. This program is a network of 11 different community-based and co-located clinics scattered within the Fraser Salish region and provides varying services depending on the size of the site and the needs of the surrounding communities. And the Indigenous Cultural Safety Team proposed a holistic and mixed methods evaluation that aims to evaluate the program and its effectiveness in providing culturally safe care for our First Nations, Métis, and Inuit clients, specifically examining client experiences and satisfaction, the program's impact on health and wellness, and as well gathering staff knowledges and practices of providing culturally safe primary care. And so some evaluation activities include perspective gathering through surveys with clients and staff, some workshops, and the collection and analysis of administrative data. Now, my project aims to support this evaluation by gathering and reviewing literature on cultural safety. It's a conceptual review, which is a type of review that identifies the current understandings of a research topic and groups articles by categories or themes. And this review of cultural safety indicators specifically used in Indigenous primary care fills a knowledge gap within our team on indicators that are meaningful, appropriate, and relevant for Indigenous peoples and communities. For the conceptual review, searches of electronic databases and great literature resulted in 18 primary research articles that center the voices of Indigenous clients and staff in primary care, and 12 public health reports that disseminate findings related to measuring cultural safety in health institutions. And from these 30 articles, I compiled a list of quantitative and qualitative indicators of cultural safety, and as well created a conceptual diagram that groups together these various indicators. And so the outputs for the organization look something like this, where at the top we have the conceptual diagram with 3 large domains, and within it several groups of indicators. And at the bottom right is a screenshot of one segment of the table of indicators. Not included on the slides, but nonetheless a part of my project was a compiled list of recommendations from public health reports on how to best go about measuring cultural safety in health institutions. And so now I'll briefly touch on the 3 domains and then present how my project fits into the broader evaluation. Within the first domain are the elements of primary health care that contribute to cultural safety. These are attributes of the providers, such as their ability to communicate clearly, their respectful and non-judgmental attitude, and cultural competence. Many studies also explicitly mention the significant role Indigenous providers have on the provision of culturally safe care. And this domain also includes attributes of the systems within primary healthcare, such as sufficient consultation time and having a follow-up system in place. The next domain relates to the attributes that are not directly related to care provision, but impact the delivery of care, such as the care framework or model services are based on, the accessibility of services, the physical environment, and how welcoming spaces are, and whether the facilities and staff are involved in community events, and if programs have and encourage their staff to take cultural competency or safety training. And lastly, the third domain relates to the experiences of care as assessed by clients. Commonly mentioned outcomes include clients' subjective feelings like feeling comfortable, respected, understood, and cared for, and whether within the client-provider relationship, clients are able to trust the provider, share their concerns, and ask questions, and receive answers to those questions. Other indicators within this domain included measuring the number of new clients and return visits to assess the cultural safety of programs. And so for the application of my project, as I've briefly explained, this review resulted in indicators of cultural safety, as well as a list of recommendations on measuring cultural safety within health institutions. And these findings informed the development of client and staff surveys for the evaluation and assisted with the brainstorming of systems indicators that could be used to evaluate the Indigenous primary care program. And while the evaluation is still in its planning stages, we have brought forth these surveys during meetings with stakeholders and are working to incorporate their feedback and ensure the surveys are not only oriented to our partners' needs, but can also answer questions relevant to improving the program. And once these surveys are drafted, they're actually undergoing cultural safety scans at this moment by our cultural advisors and external partners. And then they'll be piloted with client partners prior to the official launch of the surveys. And that's it for my presentation. Thank you all for listening. And I would also really like to thank Margot and Eva, my practicum supervisors, for their support and kind and encouraging words throughout the entire practicum, and thank my family and friends as well. Thank you.